Hello, dear friends. Especially for our listeners, we made the English version of the webinar held by Dr. Oleg Sorokin, who is the Executive Director of National Medical Ayurvedic Association of Russia. And today we'll be talking about one of our developments that we've been working on together with the Association for Specialists of Traditional Medicine. Our association works with the specialists of different approaches of traditional medicine, but our main focus is Ayurvedic medicine. On permanent basis, we provide training for specialists not only in Russia but all over the world. So we invite you to visit English page on our website where you will find the schedule for the upcoming webinars. Today we will be talking about our new project, which is called Vera Genetics, and I would like to tell you how you can integrate it in your work. But first, let's look at the current situation in clinical genetics. According to marketing company PricewaterhouseCoopers LLP of 2015, the market of personalized medicine reached enormous numbers, $232 billion, and this market is rapidly growing and its foundation is genetic analysis. If we look at genetic marketing, it's split into three parts. First segment is fundamental scientific researches in genetic field. Second is classical academic genetics that is widely used in Western medicine, but the biggest segment of personalized medicine is connected with popular genetics. Popular genetics includes the analysis of risks and predispositions to develop certain diseases and how to prevent them. Today we will be talking that popular genetics also has some flaws. For example, when a person receives the results, he doesn't know what to do with them next, and it's difficult to create a long-term rehabilitation program. In this matter, traditional Ayurveda medicine, traditional Chinese medicine, and other traditional healing practices can fill this market niche. So, if we talk about modern clinical genetics, it's worth mentioning as an example Department of US Food and Drug Administration, where it's clearly stated that genome sequencing should be done when certain medicine is taken, and genes should be tested while treating particular diseases. There are clinical protocols that advise studying patients' genes who are taking specific drugs. So, for example, here is the chart where you can see when taking atorvastatin to lower cholesterol level, patients should be tested for polymorphism of a number of receptors. Or a widely known drug metoprolol that belongs to beta blocker group. Here it's recommended looking at enzyme that is responsible for destruction of this drug. Classical case when working with metoprolol includes determining patients with three types of enzyme activity. Depending on enzyme activity, the dosage and effectiveness of this drug is changing a lot. To sum it up, modern clinical genetics emphasizes mostly on using drugs according to people genotype, studying genes of patients who are taking specific pharmacological drugs, and on the whole it can be called an individual approach. Now let's see what an individual approach is in traditional medicine. In any traditional medicine, if it's Ayurveda or traditional Chinese medicine, the focus of patient's treatment is to determine his constitutional type. If we look at Ayurveda, or you know that there are 10 basic constitutional types that evaluate the features of a person. Authentic Ayurveda has much more types, around 63, but for most of practitioners, these 10 types can help to personify the treatment. There is a very tight connection between Ayurveda and traditional Chinese medicine when it comes down to constitutional types. We have specially designed educational course to cover that topic, which is called Personal Type in Ayurveda and Traditional Chinese Medicine, where we compare these constitutional types and show that two traditions have a bit different view on same material, thus giving the opportunity for the specialist to have a deeper understanding of a patient. But why does a specialist of traditional medicine need to know the constitutional types? First of all, because we know that when you know the constitution, you can understand how disease will develop and what potential illnesses can occur. And understanding that this constitutional type is predisposed to a particular number of diseases, we can create a plan of how to prevent them. It's quite difficult to determine the correct constitutional type. That's why we developed a tool for specialists to make it simple. VetaPulse technology enables to analyze a person's constitutional type and make personalized recommendations for the disease that a person has. So we can say that in traditional medicine, the individual approach is achieved by empirical evaluation of constitutional type. But what is so innovative about Vera Genetics? In our project, we try to combine both approaches that are used in classical genetics and traditional medicine. Of course, we try to determine the constitutional type with the help of classical methods or modern technology. And after determining the syndrome by traditional Chinese medicine or constitutional type based on Ayurveda, we tell what genes need to be tested to find the predisposition to the disease. For example, if with the help of different approaches we determined that person has or person is Pitta type, we understand that patient has a high risk of hypertension, and we say let's look at the genes that can tell us about the predisposition to this illness. When we know the constitution and we have gene analysis on hand, then we can give better and more individual recommendations. Each person has its unique nature, which is called genotype. On a physical level, the constitution is determined by a complicated combination of gene activity. That's why a modern tendency that is appearing in traditional medicine is not only the analysis of empiric constitutional type, but also its supporting by gene testing. So Vera Genetics is the project where we developed 9 unique genetic cases according to 9 basic constitutional types in Ayurveda or 9 pathological syndromes in traditional Chinese medicine. Our genetic case includes the number of genes that need to be checked for a particular constitutional type. In case where we see an unfavorable genotype for a person with a certain constitution, we can assume that this person has higher risks to develop diseases. We can provide with even deeper recommendations based on 9 constitutional types. First, we give recommendations for lifestyle and physical activity. Second, constitutionally balanced nutrition. Third, recommendations for herbal therapy and using medicinal plants, specific Chinese or Ayurvedic medicine. And last but not the least is the use of energy points in body, acupuncture or marma points. As an example, I'll show you constitutional type with Vata imbalance, which in traditional Chinese medicine is called the imbalance of Qi energy. In general, people of this type have low energy level, and if they lead wrong lifestyle or their nutrition is not right for their constitution, then their energy level is decreasing faster than any other constitutional type would have. Energy deficiency, which in Ayurveda is called ojas, is very critical for developing of immune pathological diseases. For specialists, we developed a unique criteria that will allow to objectively analyze energy deficiency using VetaPulse index system. When specialist analyzes person and sees such signs, he understands that in front of him is the person with low energy level, and he can prove it not only empirically, but with the help of the modern device that can do objective analysis, which is very important to the modern medicine. We won't go through all of these criteria. You can check them later at your leisure time. You can check this unique technology that is used by thousands of specialists around the world. I will just say that nowadays there is a system of quick and objective analysis of energy deficiency in a person. In the course of our lecture, it's very important for us to understand what diseases are followed by energy deficiency. If you look at the final part of the slide, you will see that main problem is the risk to develop immune pathological diseases. First of all, it's autoimmune disorder of connective tissue that usually develops into joint problems for people of Vata type. If immune deficiency is present for a long time, it can also lead to oncology. As you can see, we developed special case for that type of people, which includes 7 genes that check the state of immune system in terms of predisposition to diseases typical for this type. Let's have a closer look at the genetic case. As we know, people of Vata constitutional type or Chi energy deficiency often suffer from joint problems. That's why testing of spondyloarthropathy is taken first place. And other problems typical for people with Vata constitutional type. First of all, it needs to be said that humans do not have good or bad genes. All genes that we have are necessary. The individual set of genes is formed in human's nature, and this unique set enables a person to uncover talents and implement them in life. In Ayurveda medicine, it's called to follow your dharma, reveal your abilities, open your dharma. For example, people of Pitta type often have mutation of a gene that encodes protein alpha-aldosterin. The gene mutation gives a predisposition to hypertension, but same gene with the same mutation makes Pitta type people very creative and very perceptive. And if a person knows his nature and follows it, and uses preventive methods to stop developing of disease, especially hypertension, then he can take the best out of his genotype and prevent negative impact. So in the conclusions that we give to our specialists working with our project, we provide them with very descriptive information of what a human gene is. First of all, for example, in first case, we were talking about that there is a gene responsible for correct work of lymphocytes. This gene is so-called brake pedal that prevents excessive activation of lymphocytes. But if people of Vata type have this gene mutated, it leads to developing of a whole range of diseases typical for them. So if your patient falls with this type, you need to pay attention to these genes, and in case you see changes in them, you can give right recommendations that will solve the problem. In modern medicine, it's called epigenomic factors, which are factors that can correct physical development outside of genome. In other words, to influence physical processes without genome. I mentioned these epigenomic factors to you before. It's lifestyle, nutrition, using of medicinal herbs, and so on. One more gene that we chose when we analyzed this constitutional type is HLA-B27. Doctors are well aware of the fact that presence of the allele of this gene is leading to developing of many complicated disorders of skeletal and articular systems. And we know that yes, Vata type people can either develop such disorders very rapidly and they will be progressing within life, or not have them at all. It also depends on the genotype and other genes involved in developing of skeletal and bone problems. And one more gene that is included in this case is the one that's connected with glutathione S transferase enzyme, which is in liver. And if a person has low energy level and ineffective work of immune system together with mutation of this gene, it can lead to complicated oncology diseases. To make recommendations for you as specialists that you can use when integrated with Vera Genetics project in your work, we give advice in the field of phytotherapy. And taking the opportunity, I would like to invite you to the unique webinar which starts at the end of October and will be held by our specialist and friend from Switzerland, Artea Smith. This seminar will be dedicated to Ayurvedic pharmacology or Javigonia, where you in detail will get information about properties of medicinal plants that grow in Europe and which we use without knowing canonical description from Ayurveda point of view. For example, with the type mentioned above, one of the most effective medicinal plants is Mongolocus astragalus, which is the mild stimulator opposed to ginseng, which can stimulate very much and cannot be used when a person has a tendency to autoimmune disorders. So here comes astragal, which stimulates the immune system very mildly. If you look at Ayurvedic description of astragalus, you will see that all the properties, Rasa, Guna, Vira, Vipaka, are highly effective to balance Vata dosha. As I said before, in our analysis, in our conclusions, we give recommendations for specialists about individual constitutional energy points that help to balance life energy of a patient. For example, famous in acupuncture energy point Wingate should be used with different treatments for people of this type. Or its analogy in marma therapy that is called marma point between lungs and is used in traditional Ayurvedic medicine. Now we will quickly look through other genetic cases which we developed for people of other constitutional types. For example, Vata Pitta people, especially if they have Rajaka Pitta imbalance, often develop typical for their type diseases. In Chinese tradition, this type conforms with empty blood syndrome, and such people actually often have hemogene disorders, impairment of gene metabolism. And this leads to particular diseases connected with hemoglobin and liver dysfunction and often affects reproductive system. Next genetic case we developed for Vata Kapha type, which in Chinese tradition is called Yin emptiness syndrome. Main problem for such people is that they have low level of agnya, as a result different gastrointestinal disorders, and the latter in its turn provokes skin diseases. Low agnya level in reproductive system also affects the chance to conceive a child. Next case is for Pitta type, which conforms to excess of Yang syndrome in Chinese tradition. With this type, we first looked at the genes responsible for hypertension development, myocardial infarction, and the stroke. Pitta Vata people, which in Chinese tradition means Yin emptiness syndrome, we developed the following case. Main problem for such people is impairment of Avalambaka Kaphi, which leads to very serious problems involving dryness of mucus and skin. Thus, we're looking at the genes responsible for skin diseases at first, but also such people have, especially in older age, the disturbance of heart rhythm, and this type has tendency to develop atrial fibrillation. Also, they are predisposed to alcohol overuse, so we're looking into genes responsible for alcohol metabolism because if they are mutated, it can aggravate the addiction. People with Pitta Kapha type, in Chinese tradition is moist and heat accumulation syndrome, are first tested for genes responsible for cholesterol metabolism disorder because they tend to form stones in various organs, most out of all types. We look not only at risk of developing of cholesterol stones, but also at others, for example, calcium stones. For people with Kapha constitution, and I'm sorry for the mistake here, it should be just Kapha, which in Chinese medicine is syndrome of phlegm and moisture accumulation. We look at genes responsible for adipose metabolism disorder. And here we can see a number of genes that analyze the risk of metabolic syndrome. First of all, we'll look into genes responsible for obesity and genes that carry the risk of type 2 diabetes and insulin resistance. For people with Kapha Vata or Chi stagnation syndrome, first of all, we'll look at genes related to oncology. These people also have tendency to different addictions, chemical, narcotics, tobacco, and unlike other types, they have a high stress level and depression, so we check genes that can predispose to such diseases. For Kapha Pitta or blood stagnation syndrome type, we developed a case where we test genes that provoke developing of thrombosis. Unlike other types, this one has the highest level of myocardial infarction, and due to blood stagnation, such people have benign changes. That's why we're looking at several genes out of oncology screening. So I showed you 9 genetic cases which we developed over several years with colleagues from Institute of Cytology and Genetics. But it needs to be said that these cases are not something final, because each person is unique even if he completely falls into one type. That's why in each case with a specialist, we can recombine the number of genes that will be tested. So those specialists who integrate Vera Genetics in their practice can consult with our experts before doing genetic testing. Right now we are developing special module that will allow you, after 5-minute test of heart rhythm, to make recommendations for genes that need to be analyzed. Undoubtedly, this will enable to automate some things, but will not substitute you as a specialist. This module will be your helper, but final conclusion of an expert is yours. So for all webinar listeners and those who watch it offline, we prepared surprise. We will teach you how to quickly integrate Vera Genetics in your work. First of all, we offer you, and I want to emphasize that, personalized training with our specialist based on your own genetic analysis on special conditions. During initial consultation, we will teach you how to correctly choose genetic case for each client based on your example. Then we do analysis of 3 genes of yours, chosen with the help of Vera Genetics technology. But most importantly, our offer teaches you to correctly interpret the results of testing, and we will always guide you during the whole period of your training. And as a part of the offer, you will get 4 additional kits for genetic analysis for free. Currently, the price of one genetic kit is $300, and special for the listeners, we have an offer of $100. So if you are interested in this information, we will gladly help you to integrate this project in your work to improve your professional skills. And here you can see how to contact us, and thank you for your attention, and I look forward to further cooperation with you, and we'll see you on our next webinar.